It's Connie Steffen calling. I'm the nurse with the Mobile Crisis Intervention Team. The officers spoke to you last evening about us? Yes, we're on our way over. This is a call that the police went on yesterday, and we got a call later on in the evening asking us to go and talk to this little girl. She's 11 years old and was threatening to kill herself. But they talked to her, and her mother talked to her, and they were able to calm her down so she wasn't feeling suicidal at that time last night. So they just wanted us to go by and talk to her and see if we could offer her something. So are you feeling like you want to die now? No?
It was only a couple hours yesterday, and then I felt better after, like before the police came, and then I was fine, and I'm fine now too.
Now, when you were feeling that way yesterday, was it that you really wanted to die, or was it just out of frustration and anger?
It was just out of sadness and stuff.
Out of sadness?
And like the unfairness of the situation.
Okay. Well, I can give you this card. You can leave a message on this phone. It will go to us, but we're not in the office, so if it's an emergency, do not leave a message on it. But if you want us to come back and talk to you, yeah, just leave a message, okay? Or you can even email, okay? I have been doing this for 8 years with St. Joe's. This is my main job. This is my primary job as a crisis nurse with the Mobile Crisis Team. Our calls that we get usually comes from here, from the workstation. It could be just a passerby seeing somebody that they're concerned about, or that someone is running in front of a car, doctor's office, the police station, and different agencies, and they'll call, and that's how we get our calls. So as long as it's nothing with a weapon, we can be on standby and go in after they clear and make sure everything's safe. A lot of it will come across as EDP. An EDP is the terminology that Toronto Police Services use for emotionally disturbed persons. So it's anybody that has a mental illness that we deal with. So each call is different because it depends upon what the needs are and what the whole situation and the problem is. We help unnecessary hospital visits, unnecessary EDPs getting charged and going to jail, and just a general diversion. We help people to get places for food, shelter. It could be a number of different things. So we're just out here helping the people in general that need help.
Because we're a specialized team, we're able to connect people with the resources that other officers might not always know about or know how to put people in contact with. And I mean, it's just it's a plus to have a nurse with a bunch of mental health background to deal with some of these calls, because from a policing standpoint, sometimes like good examples like a threatened suicide. For a police officer, if two police officers go to a threatened suicide, the way we usually work as officers is if they've made that threat and they tell us that they have, then that's basically the end of it. We apprehended them under the Mental Health Act and take them to the hospital. Whereas us as a team, we can go to the exact same call and the same person can say, no, I did threaten to kill myself, and then after the nurse speaks to them, find out the real reasons what was going on. Maybe it was just a cry for help or whatever, and then can make a determination that sometimes they don't always need to attend the hospital.
The benefits to the community is a lot of them don't know where to turn to get help, and sometimes it's just a simple thing as coming in and sitting down and sorting out the person's medications and their appointments, because any little problem when they're having a mental illness is so much more complicated for them to sort out. So they don't have to go to the hospital. It's almost like bringing the emerge department to their home.